So we're here to present to you about finance. You'll see us get up and down. We are not a panel. We're here to talk and actually interact with you about finance and see how much we can help you understand about blending and braiding funding and what you guys are going through to see if we can walk you through a few various tools. Um, you'll see us get up and down. I want to talk to you about the what, when, where, why, and how. If there's one takeaway we want you to understand is I want you to leave with today. Braiding funding isn't a fiscal tool. It's a leadership strategy. And I don't think I ever really thought about it in that context. But let's start with a simple truth. California has never seen this much investment in children and youth well-being. We have so much money that is we have access to, but are we working together to spend it? Really, it's taken us a long time, and we're not where we want to be. Between education reforms like LCFF and CCSPP, we use a lot of acronyms in education. I come from education. Mental health initiatives like CYBHI and MHSA and justice reforms in juvenile services, we are awash in opportunity. But the way of investment has also created turbulence. Over the last decade, we've built incredible programs like CYBHI, but too often we built them in isolation. We work in silos in education. The funding streams that sustain themselves remain siloed by agency, statute, and reporting structure. That's what we mean when we say fragmentation. It's not going to be successful if we're fragmented. In practice, fragmentation looks like this. A student receives counseling from a school psychologist funded through LCFF, which is local control funding formula if you don't know, while also seeing a medical therapist under county behavioral health and participating in a mentoring program supported by a state agency. How many of you have experienced this? Only one? Only one brave soul raised their hand. And how many people talk to each other when you have 3 different case managers? I love your ex. Oh, no one does. You're right. And so when you see each service is very valuable, but they report to different departments, use different data systems, and they often don't coordinate care. That's why we're at Breaking Barriers. It's all about coordination of care and helping the youth today. The adults aren't working hard, or the adults are working hard, but the system isn't working together. Fragmenting financing leads to duplication, multiple assessments, multiple referrals, sometimes multiple case managers for the same child. It also limits sustainability. We need to sustain our services. COVID did not help that at all. When grant funding sunsets, services collapse because no one has mapped out how those dollars braid with ongoing sources. And for families, fragmentation shows up as exhaustion, retelling their story, navigating disconnected roles, and waiting for weeks of continuity of care. Families and teens get burnt out and then they drop out and then we cannot help them, and that's the last thing we want them to do. They don't have the ability to talk to someone live or in their language, and then we end up not being able to serve them the way we want to. So fragmentation isn't just a funding problem, it's a leadership challenge that we need to fight together. When money is organized in silos, leadership tends to follow those silos. That's why braided funding matters. It's not about spending more, it's about spending together. The more success cross-agency partnerships, the ones actually improving outcomes for kids and families, start with 2 things: shared governance and clarity of purpose. When leaders commit to joint ownership of results, funding alignment follows. Take our county systems of care for an example. The ones really moving the needle have figured out how to braid Medi-Cal, education, child welfare dollars, not because we've gotten more money, but because they've created alignment accountability. They're using existing resources in a smarter, more intentional way, with everyone at the table owning their own results together. They're working as a team and they collaborate for the youth. Effective integration depends on financial transparency. This is not a new term, but this is something new for teams to really utilize. Transparency is key. When we actually mapped out our existing resources, all the terms I just used, all the acronyms, we start to see our dollars overlap, compete, and leave gaps. If we can see this on a map, we can actually see what's visible, we can make better choices, reduce duplication, and actually figure out where our underused funds are. Do we have underused funds? Probably not, but sometimes we do. And we can also reinvest where we need to. We can find out, do we have empty dollars, empty resource codes? Can we fill or backfill? Can we use grant funding? And do we have access for care for students if we partner with others? That's a significant shift. So the real momentum is CalAIM and AB 133, as you guys know. And now with the new CYBHI fee schedule, it's going to open doors for communities and schools. For the first time, we're seeing real bridges. So as we move forward today, I want you to keep one question in mind. Can we braid together? What can we braid together next? Because in the end, money shapes systems and systems shape outcomes. Braiding funding gives us a framework for rethinking both. It's just not how we fund, it's how we lead together. I'm going to let Mike come up and talk about the next.
Everybody's excited and invigorated to hear about braided fund, and I love it. Woo! All right. I'm glad you're all as pumped as I am for this wonderful afternoon topic. So we're going to dive into braided and blended funding, and I really want you to think about 4 core principles or pillars as we talk about this conversation. And think about why we're here as well. So you're here at an integrated leadership conference, an ecosystem conference, breaking down barriers, working together. And I'll preface this and probably say it several more times by the time I'm done talking. I don't believe there's any universe where we're going to be able to continue to do what we do for kids without thinking about things in an integrated way. And these 4 principles of vision alignment, fiscal mapping, governance, data and accountability. You've heard Jason talk about this, you've heard Natasha talk about this, but we have had unprecedented funding. When I go to other states and talk about all of the funding California has, they think I'm making a mistake when there's a B after $4.7 billion. They think, well, you're making it's really $4.7 million, Michael. No, we have experienced, the word that jumped in my head right now is excessive funding, but it's not excessive, it's what was needed. However, it also causes a little bit of a problem. And I know I'm causing some anxiety to my friend in the back from Solano County. All of that money and all of that funding is coming to an end. We have a 1-year runway, 2-year runway, but it was great. We implemented lots of good programs. Jason talked about some of them. But now the tidal wave of funding has turned into a tsunami. And that's us. We're that little person there running for the shore with the arrows pointing to us. And now it's time to think of how are we gonna survive this? And usually when some of you hear me talk, I'm not as much of an alarmist, but I'm truly starting to get worried. There is a lot of services and programs on the line, and we only have a couple to 3 years funding between community schools, between our capacity grant to really get up and running the fee schedule. So now's the time to be that person and start thinking about how are we going to truly effectively collaborate with each other. So a life preserver, braided and blended funding. Braided funding is our opportunity to combine multiple funding streams. Each stream has its identity, it has its rules. We need to be very careful about those grant rules and monitor how we're spending those dollars, but we're able to use those dollars to braid together. Blended funding typically is much more flexible. Dollars that we can use flexibly, embed in our systems, not as much accountability. sometimes a little less risk with blended funding because of that greater accountability, and we can pull those dollars. So you might get a grant from our friends at Kaiser Foundation to work with youth who are at risk implementing SEL programs. And that might be it. That's all it says in the grant, right? Or you might get a grant that comes with much more strings attached. But we need to think about these two as we shift towards integrated systems. So what I want you to think about, because the bulk of our money comes with many strings attached, is how do we braid that? How do we have a rope for the life preserver and braid funding together, allowing for lower risk as we braid those resources together? Things like our managed care plan partnerships. In many, many counties, I'm seeing managed care plans now becoming part of the integrated leadership team. Managed care plan under CalAIM is implementing enhanced care management, or ECM. This is an amazing opportunity to help support our communities, whether it's schools doing ECM, community-based providers providing ECM, or um, even I heard in one instance, CASA, court-appointed special advocates, implementing ECM. We might think about county behavioral health and EPSDT. How do we braid that into the ecosystem of funding that we're trying to support our children and communities? LEA Bob. I know there's a lot of tension in some communities around LEA Bob still, but it is 100% worth looking at, and do not give it up in lieu of CYBHI, but look how you can do both of those together. Again, our managed care plan is up there. Probation, JJCPA, and YOBG, I'll give an example of that in a moment. Health and Human Services, maybe partnering to utilize Families First Prevention Services Act, FFPSA. I know my social service friends out there saying, wait, that's not coming yet. It's looking down the road, it's coming. We're going to have an opportunity to use FFPSA in all of our communities for the most high-risk children. What a great opportunity to offset. I'm not going to get deep into CYBHI today, but it's not going to pay for everything, people. It's just not. So FFPSA might be a way to braid that together, or supporting prevention of children who are exploited. There's an opportunity to partner with social services there. And then, of course, the education multi-payer fee schedule, which we've talked about. So the point is that we have to start thinking about things much more differently than we have been. And I know some of you are well on that journey. Some of you are just starting out that journey. But it's the only way we're going to survive this tsunami and this change. And I'm not going to get super political, but the federal environment changes daily. And so the way to weather that storm is to work together in an integrated way and think about integrated funding. To use these key features of vision alignment, shared goals and outcomes, I'll talk about in a moment, fiscal mapping, governance and decision structures, and data and accountability. We'll look at some models now. I'm going to turn it over to Chris to explore case example 1, and then I'll jump back in.
Great. I'm just going to stay here if that's okay. Do you mind just forwarding our slide there?
Yep, you're good.
Fantastic. I want to just go back to something Jason said, because I love the 4 points he made. And in particular, the point about looking at every line item and prioritizing and making those hard decisions, and understanding your spreadsheets. And I would challenge us to go even further than that on like you were talking about a district and a school. I would say, I would ask you all, are you sharing your spreadsheets with your partners? Like, does the school district understand how the behavioral health funding works? Are you willing to sit down and really explain it and educate each other so that you can ask those hard questions across agencies? So there are places where that is happening, and I think we need to think about what are the challenges, the barriers. There's some political barriers there, but as we talk about these different examples, I'd ask you to keep that in the back of your minds as we're thinking about like how far can we actually go towards this fiscal integration. So
Can I say one thing real
yeah,
quick?
please.
You've inspired me.
Yeah.
It's about transparency.
Yeah.
These are not our dollars.
Nope.
This is the community's dollars that we're charged with taking care of. So keeping those spreadsheets secret or squirreled, we need to just open those books up in order to find out how to integrate and braid those dollars in a most effective way. Thank you. Sorry.
Exactly. And
Got me excited,
when
Chris.
Yash can talk about CalAIM and CYBHI and all the funding streams like that, we've arrived if every young person that is getting services from you all actually can understand what those funding streams are and even give you ideas about, right? About where to go to get that money. Yeah.
If
So-
we're not transparent, how can we work together? I mean, if we're from different agencies and we're not transparent, then there's no way we could work together, which is why we're all three of us up here are talking about transparency.
So Alameda County, which is my peeps, where are you? Are you here? All right. I know the folks from social services aren't here, and I don't know if probation is here, but we entered into a really interesting, and is Allison, you still here? All right, there you are, Lincoln Families. This happened long before there was CYBHI and has been going on for at least a decade in terms of a wraparound program where the behavioral health department, the social services, child welfare in particular department, and probation came together and said, we got to figure out a way to be able to fill the gaps when specialty mental health could not, was not able to fund services that were being provided to families in their homes. And just getting very granular about how this happened, Lincoln has a contract with the behavioral health department in Alameda County. They are funded, their costs for providing those services by the behavioral health department. And then there is an MOU that exists between the behavioral health department and the social services department and the behavioral health department and probation. And those entities for their young people are backfilling those gaps. Allison might correct me and say, well, not fully, but but it certainly for many, many years has allowed the provider doing those services to provide the service, bill the service, and then not worry about, am I going to get paid because I did a service that the family needed, but one of those entities doesn't cover it. And so it's a very specific example of ways that public agencies and providers have come together to look at, we're going to use every dollar we can for Medi-Cal first, and then where are the other places that we can get those funds to support that young person and their family. Back to you, Mike.
Actual case example 2, that was case example 1. I wanted to lift up the work of BHSSA, Behavioral Health Student Services Act, formerly known as Mental Health Student Services Act. I was telling somebody this morning, I think BHSSA, frankly, singularly helped us turn the corner for mental health in schools. It was the first real estate investment into fund and services for children, children's mental health supports where they're at in schools. But it required that we collaborate together. So a foundational requirement of BHSSA as it was awarded to county behavioral health departments was that you had to establish a partnership with your school partners. And in fact, in the original triage grant, there were more points awarded for that collaboration. So a real focus on breaking down those barriers and impact in children across a continuum, not just behavioral health, but for their child welfare needs as well. Um, Example I wanted to lift up was Orange County. They utilize their dollars in a unique way. In some counties, BHSSA went to behavioral health and they focused on a school district or a few schools. In Orange County, they've spread these dollars out through the entire, through all the districts within the county. So all schools were able to participate. They were also able to leverage this funding when SB HIP came along and forge a really unique relationship with Cal Optima. So Cal Optima, their managed care plan now, is part of the ILT. In fact, our integrated leadership team meeting in Orange County is hosted at Cal Optima. That's where we meet. So in Orange County, these dollars went to coordinate, embed, really move upstream, strengthen LEA and behavioral health partnerships with the managed care plan. You can see it increased collaboration across all mental health programs. It's forged this relationship between the two departments to integrate these dollars, both with education dollars, our managed care plan dollars, and behavioral health dollars. The next example is looking at how we've integrated funding through JJCPA or YOBG, the Youth Offender Block Grants. These are unique dollars that are passed down to probation departments. The first example I'm going to use is from Placer County, where I formerly work and spent 20 plus years of my life supporting integrated services. Has to do with the Crisis Resolution Center. So our problem was juveniles, youth being moved into the child welfare system or juvenile justice system for problems that could have been ameliorated really in the community. They were moved forward because of arguments or the police show up one day, unable to resolve a conflict between a child and their family. They don't know what to do. So they end up arresting the juvenile because they threw a telephone at their parent in an argument. Assault and battery, right? So I'll put this youth in juvenile hall because he didn't know what to do. So we needed to embed an alternative in those years. And our alternative was to create a space where youth could come and be at in a voluntary placement up to 30 days that were not in the juvenile justice system to prevent entry into the juvenile justice system. So probation invested nearly $1 million in a relationship with a community-based agency, Koinonia Group Homes, to develop the Resolution Center where youth could come and be there and get family therapy, get services. The center literally is like walking into grandma's house, but with therapists there for up to 6 to 8 youth, 13 to 18 years old. And everything was going great until one day the state just shut off JJCPA. There were some reporting problems. I'm not really sure what was going on, but we got a letter, I think it was in May, that the state's no longer going to utilize JJCPA funding. And we had this $1 million program. So at that point, our child welfare department, our system of care, turned around and made a $1 million investment to keep it going for that year and replace those dollars. It's that type of integration and collaboration. The other two examples I have here are also amazing examples from Sonoma County and Alameda County, where they're using JJCPA to work alongside community-based providers to embed them into early prevention programs And when you get the PowerPoints for the presentations, you can link there. Back over to
We'll do it
Nata-
together.
Okay.
Okay, so number 4 is actually something that Michael and I and ESS have done together.
Effective school
Oh,
solution.
sorry, effective school solutions. This is something that is very new. As you guys know, the Wellness Coach initiative is something that's very new. Effective School Solutions actually rolled out one of the largest plans for wellness coaches. And we worked together with Michael, Santa Maria Bonita School District, and HCI really to see how can we roll out something very successful. We started with seed money, with grant funding, but it's really important to be transparent, once again, with the district, with all different agencies, and how do you coach a school district with an outside agency and a vendor to work together to sustain a plan? That is something super difficult. And you also have to think of sustainability because of the youth. They're going to get attached to services. It's in the gen ed setting. You want to do something successful for a district, but you also need to look in the future to sustain it. And you cannot, I guess, depend on grant funding or depend on one single source to fund it for a long period of time. And so we all work together as a team. And now it is something that's embedded in their school setting that they can sustain on their own for years to come.
These were 55,
Yep.
55 wellness coaches to ramp up within the school district. And we gave ourselves a couple months to do that. I think we met our goal early even. It's just no small feat to onboard that many people. And it took an integrated, consorted collaboration with Santa Maria Bonita to be able to do that. Also, Santa Maria Bonita, because we know as wellness coaches are ramping up, aren't going to be fully funded. They're just not going to be fully funded. So if Santa Maria Bonita is offsetting that cost to braid those dollars together. Table talk.
So to get you guys engaged at your tables, we would love for you guys to discuss examples. We'll give you about 5 minutes to really talk about, do you have models that you've implemented or that you would like to implement that blend or braid funding to support your programs or initiatives? So at your tables, talk for about 5 minutes and we'll come back.
Hi, it's me again. Yeah, so I showed that slide earlier of all of our different, funding opportunities and all the grant opportunities that we have. Um, and I also mentioned that we're breaking even despite all of our efforts. We are working with the fee schedule. We've had a number of our peer specialists become wellness coaches. But what we found is because we have this kind of niche of preventative health care, we are only about to bill for about 30% of our activities. Everything else, whether that be, let's say a kid comes in and they don't necessarily interact with a clinical staff member, but maybe they talk to one of our peer specialists for 10, 15 minutes. Up until those peer specialists were not certified as wellness coaches, we were not able to bill for that. Additionally, another problem that we're running into, despite all of our efforts to braid all of these different grants together, is there is just an overwhelming need for our service. We serve Service Planning Area 8 of Los Angeles County. So that is going to be essentially the entirety of southwestern Los Angeles County. So about 3 million people. I'm not sure what amount of those are actually youth, 12 to 25, but definitely a very significant amount. So yeah, that's the two kind of issues we're running into is that we are trying to braid everything together and we're going after county, federal, state, but even so, our need and our services are just a little bit too much and a little bit of a niche as well.
Well, and I would ask what investments what's happening relationship-wise between you and those funding partners? Are they hearing about what you're doing? Where is the opportunity for them to maybe learn more and think together with you about, finding every penny in the couch cushion?
Yeah, definitely. And that is something that we do the properties committee as well as our CFO have quite a long relationship with the Los Angeles County Department of Mental Health and the Los Angeles County Department of Public Health. Because we are technically our own public health agency, but we collaborate with those guys. Um, and again, the issue that we're running into is that it's Los Angeles County, a county of 10 million people with,
Yep.
you know, LAUSD needs help. The thing that's interesting about us is that we are the cities of Redondo Beach, Manhattan Beach, and Hermosa Beach, and generally, just because of the amount of property tax we charge and other factors, a lot more of the community-based money that's allotted goes to areas that are maybe in the south central area of LA or to areas where support is really, really desperately needed.
Yeah.
So there's just a number of these little dichotomies going on that makes things, almost aligned, but not entirely, is what we're experiencing.
I mean, what you're bringing up are all the political realities as well as the need. But that's something I know that all of you, if you're running agencies and you're reporting to boards of supervisors, you ultimately also don't have all the decision-making power about how the funding works. So who else has a good example that you discussed at your table? Yeah. Great.
This is my teacher voice, so no, I'll be soft. I was a kindergarten teacher. So there is a disconnect that mental health and education are two separate entities, and they're not. They're one and the same. If a child has a mental concern, they're not going to learn. That's just it. If they're hungry, they're not going to learn. If they're homeless, it's hard to learn. So that's the first disconnect. And our current DA funding mechanism from the CDE does not equate for that. And so that's a problem because in a county office, in a district, we're providing technical support to the districts, to our LEAs. And when there's that disconnect, funding the wellness coaches should be an automatic. We shouldn't have to think of what do we have to sacrifice to provide some social services to the student or the district or the wellness coaches in this case. So for me, at least for what we discussed, is the misconception that academics is not attached to mental health, and it is. It's one and the same.
Yeah, and certainly the federal government isn't going to help that, are they? But what are you going to do? Like, what's your action plan for at your district, county office, county level?
So I'm
Can
going to
you-
retire in June.
Oh, no.
I tried that.
I'm just joking, but I am going to retire. So anyway, no.
But you're going to find your replacement, and you're going to train them really well, right?
Yeah, we'll train them well. But one of the things that we did do is for the DA funding proposal for the BASC and CISC, the curriculum instruction and BASC at the state level, we are proposing a new DA funding proposal so that it does give us funding throughout the years. It's not when needed, it's not a mechanism. If you fall under differentiated assistance, then we're going to help you. It's going to be constant, continuous funding throughout to support some of these initiatives. So that's one. But one of the things we did talk about is looking at our grants, looking at what the restrictions are for the grants, whether they're state or federal restrictions, and finding a commonality so we can take some of those grants and continue the sustainability for our wellness coaches moving forward.
I love it. Are you from a district or a county office?
Should I say our county office? Yes.
Are your
Yolo County Office of Education.
Okay, and are your behavioral health folks at the table there?
Yes.
Okay, so you're working together
Yes.
to share your spreadsheets.
Yes, we are. We do cross-department collaboration, cross-division collaboration.
I love it.
We actually do not work in silos.
I love it. That's fantastic. I have heard great things about YOLO. And I was reminded as you were doing your table talk that we have another whole big shift that's happening. How many behavioral health directors or children's directors are in the room? A couple. BHSA is yet another huge reform that's about to happen. One component of what is happening at the state level through BH Connect, if you're aware of it, is the development of EBPs to provide those full service partnerships. One of those is going to be wraparound, and it will be a required component of this full array of services through BHSA. There's a lot of effort there to make sure there's a great deal of transparency. But again, you can't know everything that's outside of your own department. But when you are sitting at tables like you all have and really sharing all of the different initiatives and changes that are happening in your counties, that's where you can say, okay, let's get our hustle on. How are we going to figure this out? We've got 6, 12, maybe 18 months to really prioritize and decide where are we going to put our funds, where can we get the biggest bang out of every dollar. So one more example, and then we're going to keep going. Yeah. Ooh, okay, let's talk.
I was working at a little college in Arizona, and we were a bunch of zealots, a bunch of young zealots, and we were coming up short. We had no money. And so I was on the board, but I was working on the college as well. And the first thing you want to do is feel really bad, right? Because you're scared and you're not getting that paid that much anyway. And you like where you live, you like your mortgage, you got kids, you got boat payments, some people had car payments.
You're going to retire.
Exactly. So we sat in a circle. The president, his name was Ralph Borison, sat us in a circle, and he told us all, open budget, what are we going to do? And we were all zealots, so that helps. Like, we were all zealots. Like, come hell or high water, this college is not going bankrupt, because it had gone bankrupt about 15 years ago, and they saved it. So I didn't have to save the first one. And we, honest to God, sat in a circle and decided, how much money did you need? Right? And we all had contracts, and we're all faculty and administrators, and how much money, like, gulp, right? And you know, the contracts aren't open budget. We all didn't know how much each other were making, and some of us, I was married, I had a professional wife, so, you know, yay me, right? And no kids yet. So, and so, gulp. And it's like taking your clothes off. It's like being naked. Like, okay, because no one wants you guys don't talk about your personal budgets, right? It's nobody's business, right? We all guess, like, what kind of car you drive in and stuff. And so it started, and we had to go around the circle several times. And there was no peer pressure. It was just, can we keep the dang thing open? And that college is still there, and it's thriving, okay? I left that college because I didn't want to do that circle thing again. And I went to a college up in Alaska that was very well funded by the Presbyterian Church. It was a native boarding school. It was a native mission college for Alaska Native kids. And we sat, when our money started turning down, people started praying to God. And people started pressuring their donors. And this was in the 90s and early 2000s. Money was tight, right? And the money wasn't coming, right? So I did what that young lady over there said. I just left. Like, this is, here, take my salary and benefits. That's a little bit of a help. Wasn't enough. That college is bankrupt, right? So some people went praying and spraying, and some people decided, and many of those people who sat in that circle with me, about half are still there. With all of your fear, because that's where it comes from, you say, I'll pay you to go find money. And I'm telling you, I'm pretty good at it, but if there ain't no blood in the rock, you can pay me and I'll sit and worry with you and it sucks. But I get paid, and you got to make hard decisions back in your staff. I'm not here to seek. I'm retired. You can't hire me. But I'm telling you, I sat with very good people who could not make hard decisions because they didn't want to be naked in front of their peers.
Yeah.
And
Yep.
And we can beg, we can talk about what happens in DC, what happens in your state capital, what there's some rich donor across the street. Your dad may die and give you all your inheritance. That's magical thinking in my experience.
Thanks,
Please,
Derek.
please
I got to
look
cut
at
you off because
that.
I'm getting a cut off over here. Sorry about that. But you're making a great point. I want to remind people breaking barriers existed many, many years before this big tsunami of money showed up. And you all were doing, many of you were doing that work long before you had all this, let's call it extra money or even new funding streams that currently exist now. So it is back to how important is it? What are the priorities? And how are we going to cross agency as leaders really share that decision making, really put each other to the test, and what are some of the practical tools that we can use to get there? So, back to Mike.
Thank you, everybody, for participating. We are going to get you there. I'm going to skip that slide. Look at that, making up time right there. We already talked about that stuff. So what can we do about it? First and foremost, we are here at Breaking Barriers. So what I want you to do is really think about your integrated leadership team processes at the county level. I want you to have a clear shared purpose that's clearly articulated, a simple, compelling mission that we rally around as we integrate our services and integrate funding. I want you to have a balanced collaboration. And I want to design your collaboration to distribute power. If no one's in charge of a system of care, it's a collaborative effort. You might have and in fact, you need a host agency or a chairperson, but that should rotate about every 2 years. These things, by the way, you will find in the T2 ecosystem guide that's been developed, and the guidance book is coming out soon. I want you to lean towards, and we saw this from Mathematica, operational integration, where we're co-locating staff. By doing that, you're going to build effectiveness and efficiency in communication. You're going to reduce the duplication of work as well and be able to deliver that. I give you a couple examples here of a mission statement that all children in fill in the blank, your county, will be safe, healthy, at home, in school, out of trouble. You heard this last year from our keynote speaker, and if you focus on that as your North Star and make decisions like our friends in Yolo County are making around all children in Yolo County, I think we can do this work. And as we operationalize our integrated leadership team, we'll provide unified cross-agency leadership that drives policy, practice, and fiscal alignment. It needs to start here at the ecosystem level, at the ILT level. A couple tools for you. I want you to think about a braided funding matrix. We talked about transparency. This is the way to do it. This is, in years past, you've heard this phrase, put the money on the table and your hands behind your back. That's what this activity does. It creates a matrix that can be shared across our agencies. So we can literally and physically look at where are our dollars being spent. Are we doing that in most effective way? Can we move dollars in a shared way to leverage it better? Maybe the county office can leverage wellness coaches better, or maybe Santa Maria Bonita in collaboration with ESS can do it a more effective job, or maybe it means child welfare funding, supporting an integrated youth center to prevent kids from permeating into a deep end system where they don't need to be. I want you to chart shared roles, accountability, and do not just think about charting it, but explicitly do this activity. Physically chart your responsibility and accountability to fiscal processes and operations. I want you to have an integrated fiscal and outcome dashboard. So if our mission is that all children will be safe, healthy, at home, in school, out of trouble, what is the data set that's going to get us there? And that data set that you agree on with your partner agencies. And then how do we fund our journey to those outcomes? Literally mapping what dollars are going towards achieving this vision and mission. And then cross-agency systems map. I'll reference here a cascade model design out of the University of North Carolina and their work in implementation. But to go to that website after you leave today and really look at what's the role and function of our ILT? What's the role and function of the EAC committees underneath, all the way down to the site level and the community level with your cost teams, and literally and explicitly map that out in a cascade model. And when you look at this model, you'll see that there's feedback loops using data to feedback to the ILT. Are we achieving that vision and mission?
Okay, we were going to do a table talk, but we're going to go really quickly through this just because we want to hear some comments from you. We had some discussion plan or questions planned. What barriers exist in a fiscal alignment in your system? So what barriers are you guys experiencing right now in terms of some of the fiscal challenges you are having? Anybody? Nothing? Okay, I'll try another. No barriers at all. Which agencies or leaders must be a part of your braided funding effort?
Oh, I heard it somewhere in the back.
I did, I heard it too.
Shout it out.
Oh, good job. Okay, what might you begin embedding shared accountability?
What one thing are you going to take back home from this?
Just gave you the list.
What are you going to do?
Tell us.
All right.
There you
Use
go.
Mike's toolkit. What else?
An MOU.
There you go.
Educating other partners. Love it.
Awesome. So we're going to quickly close. If there's one lesson we've learned through doing this work, it's braided funding is not just a fiscal tool, it's a leadership mindset. But the real power lies within aligned purpose, accountability, and across our systems. Every effective collaboration starts with a shared vision. We all know it's all about transparency and sharing our aligned vision together. Vision drives finance, not the other way around. And the second pillar is a fiscal mapping. You guys saw what Mike showed you. Please use all of the tools we've shared with you. It's very, very important to work together. We cannot do this initiative or be successful if we don't partner together. I know Elizabeth's coming up here to do a final closing statement. I know, Chris, you want to do a final closing? No? Okay. So we want to just make sure that you guys know there are lots of tools out there. We are all here to support you. Chris, Mike, and I have also left our contact information. We all come from education from some sort or an outside background. We're all clinicians to some sort as well. Please feel free to contact us if you have any further questions. We have lots of information in the slide deck. We are here to support you. It does work. We have all experienced everything that you're going through, I would hope. If not, we will find an answer for you. We can please reach out if you have any questions.